Good evening, good afternoon, and good morning to a lot of you. We are so excited. This is our very first global town hall. And first and foremost, we thank you all. It is incredible. We have over 150 participants from the entire globe who have signed up for this. From the US, from UK, from Israel, from South Africa, from everywhere. So thank you all. I applaud you. I virtually shake your hands. And before anyone does anything, I'd like you to take your right hand and cross it over your chest. Take your left hand, cross it over your other chest. Give yourself a hug, because this is a real hug. It's a real hug from our children at Beit Issie Shapiro to you for being here today and for being with us always. Before I get started, I just want you to know there will be time for a Q&A. It's at the bottom of your screen when you toggle down. It's not the chat box. It says Q&A. You can write in your question, and at the end of this session, we will try to answer as many questions as we can. We're all aware at this time we're living in unprecedented times, challenge, fears, the unknown. But today, we're going to give you updates of what we've been doing with our children. What we've been doing through this corona, very encouraging updates. We've learned a great deal. And you know what? We found a lot of silver linings. In fact, some people say we've taken lemons and made lemonade. We haven't taken lemons. We've gone in lemon fields, orchards, and making lemonade. So this is really, really a silver lining. In fact, look at our unique event, 150 people, and by the way, counting already. Only realized through technology. That's what's brought us together. Israel's slowly reopening. As a result, we're so excited. Beit Issie Shapiro has opened its doors in accordance, obviously, with ministry guidelines. Our children have been able to resume learning in the special education school in the Delo. And in fact, I'm going to introduce you to one of our very beautiful students, Ria, our 11-year-old, who's been a part of the Beit Issie Shapiro family for years. We'll meet her father, Ziv, later in the evening, morning, or afternoon for some of you. We'll be talking with her teacher, Vanessa, about the challenges, about what we've been going on through. In fact, now we'd like to introduce you to beautiful Ria. Here she is. She's coming.
לשתף אותנו באיזה כיתה את לומדת? כחולה. באיזה בית ספר? בבית ספר איזי. נכון. ואת רוצה לספר לנו בת כמה את?
בת 11.
בת 11, נכון מאוד. אז ריוש, את זוכרת שהייתה תקופה שהיינו בבית עם כל הקורונה, ואז חזרת לבית ספר. איך היה לך?
כן.
מה היה לך הכי כיף כשחזרת?
הגעתי לחברים ולצוות ולחברים.
התגעגעת לצוות ולחברים. האם התגעגעת לשיעורים?
כן.
איזה שיעור את הכי אוהבת?
עברית, חשבון.
איזה יופי. מה, יש משהו עוד שאת רוצה להגיד אחרון?
אני אוהבת אותה.
גם אני.
Wow, thank you. Thank you, Ria. Beautiful Ria. And it's time, I'd like to introduce you to Amir Lerner, our executive director behind the scenes, making it all happen. Amir was a navigator in the Air Force. From the little I know, my mother was also in the Israeli Air Force. I don't think they taught them to navigate a virus like this. So kol hakavod, Amir, from all of us. They teach them to navigate these huge 10-ton airplanes, not this situation. And he's come through with flying colors. Amir also served for 22 years in the Prime Minister's office. He was Deputy Director of Logistics and Security and Director of the Leadership School. And as a result, I can reassure you all Amir's business mindset equipped him for very quick, very decisive decision-making and leadership during this challenging time. Amir, take it away.
Thank you, Esti, and welcome everyone. This is another first for Beit Issie Shapiro as a result of the Corona crisis. And it's such a special feeling and occasion to have so many staff and friends and supporters of Beit Issie together from 4 continents and so many time zones. So thank you all for joining us, and it gives really the feeling that together we're a true force for change. Just before I start talking about Beit Issie Shapiro, I would like to send out a prayer, a hope, a wish. First of all, that all our communities and you and your families remain safe and healthy, and especially reflecting on the last few days, that our communities remain tolerant and we work together towards a more cohesive society. And now to Beit Issie Shapiro. And as many of you know, Beit Issie Shapiro is a pioneering innovator for people with disabilities. We provide services that change lives, and we export technologies and best practices around the world for a more inclusive society. We're impacting more than 500,000 people globally, and that's before we start counting the effects of the digitalization we've gone through in the last 2 months. Beyond working with children and adults across a wide range of disabilities, we're distinctive and we drive real social change. We do that by researching what works, by sharing our knowledge, by training professionals, and by persuading decision makers to act. What began in Israel 40 years ago is now a place the world looks to for answers. And throughout all those years, we've still retained the culture and drive of a startup, always seeking new solutions. That was the dream of our namesake, Issie Shapiro. That is who we are, before Corona, during Corona, and after Corona. And for making all this possible, Naomi Stuchiner, our founder, has received the highest civilian honor possible in Israel this year. During the Corona crisis, all these 40 years have come into play. 40 years which have earned Naomi, and through you, Naomi, who's with us tonight, all the staffs and friends of supporters, the most prestigious prize, the Israel Prize for 2020. Naomi, we are so proud of you, all of us, for what you have done and for what you're still doing every day to make this world a better place. Your vision has given us the ability to persevere throughout this crisis. And I'm so happy that you joined us, and I'm honored to give you the Zoom now so you can speak to everybody.
Wow, thank you, Amir, and hello to everybody. I had a chance this morning to glance through not to glance, I did it more seriously, to look at all the people who have registered and are participating this evening. And as Esti said, we send a big hug to all of you. Thank you for joining us. This is a very, very exciting time for us. Despite the fact that we're in Corona, and thank God in Israel we've taken a few steps forward, we have had an opportunity. People said that it was a little bit of a light during a difficult time. And I want to thank you, Amir, for leading Beit Issie through these dark waters. And I am so proud every single day. I was so excited to see the different inventions and the different interventions and the treatments and the YouTube and everything that the staff, the amazing staff of Beit Issie Shapiro did in order to make the lives of our children and our families in 3 different languages. And you'll tell everybody about it a little bit later. But I want you to know how very proud I am and how very excited I am every single day to be part of this wonderful organization. Now, it's 40 years. 40 years is a long time. And just next week, we will have the 40th yahrzeit of my late father, Issie Shapiro, whose dream was really a dream of social change. He wanted to come on Aliyah and to make Israel a better place for people who have disabilities and for their families. He spoke about equality and he spoke about equal opportunities and rights. And that was our vision, that became our vision. When he passed away, we sat Shiva, and already with the Trumps, our amazing Trump family who've been with us all through these years, we made a decision that we were going to see what we can do in his memory to realize his dream. And I have had the kavod, the honor, to be able to do this over these 40 years. And I've only been as successful because of Beit Issie Shapiro and the amazing staff and the people who join us every single day, the families, the parents, the children themselves, and the people with disabilities. And I feel so privileged every day for Beit Issie Shapiro and for myself and for my family that we've had this ability to be able to do something that is now recognized in Israel as worthy of the Israel Prize. I'm thrilled for the field of disabilities. I'm thrilled for all the people who've been involved, and I'm thrilled for you because you are our supporters and you've invested your time and your love and your money. That's very important. To see Beit Issie. I don't think any of us dreamed, but it happened. And thank you all for being with us and for making sure that the values that my late father left for us and the dreams that he had have been able to be realized together as a big family worldwide. We're thrilled and so happy that this time when Corona has hit everybody so hard, that this little dream has come true and that we can all share it tonight. So thank you very much and enjoy the rest of the evening.
Thank you, Naomi. And on a personal note, I'd also like to thank you for all your guidance and mentorship throughout the last few months. They've been a huge help and a great honor to work with you and see you every day, either on Zoom or in person. So, as we in Israel are slowly reopening the country and easing back into a new reality, it's a good time to look back and reflect on what we've done over the past 2 months, and also think about how this helps us as we look forward towards the future. And this is what we've been doing, because in times of crisis, what rises usually are the basic needs of people. But because it's a time of crisis, then these basic needs require very innovative solutions. And that's Beit Issie at its core, providing innovative solutions to anybody who needs it, and especially to our children and families at the centers in Ra'anana and Kalanswa. And when all the globe is in such crisis, and the crisis is of such magnitude, that it sometimes helps to look at it through a more personal perspective. And that's what I'll try to carry over to you over the next few minutes, giving you a few examples of issues that we've related to in the past 2 months, how we've treated them, and how we see them helping us build a bridge into the future. We'll start from the emotional hotline we opened up at the very beginning. And I'd like to tell you one story, one call that came into that hotline, which I think shows very precisely what it means, what difficulties families with people with disabilities in them face. This call was from a woman who has no prior connection to Beit Issie Shapiro, and she reached the operator on the hotline, and usually the operator just takes down a note and says, "We will call you back as soon as possible within the next hour or so." The operator, though, realized this call needed an immediate response, so she called up our professional, Shafi, who's in charge of the hotline, and Shafi, of course, said, "Yes, I'll take this call immediately," even though it wasn't her shift at the time. And when she was transferred the call, she heard a very distraught woman on the other side of the line, and her child, screaming in the background. And it turns out that this child was on the autistic spectrum, and his mother had just told him that this year they won't be able to join the traditional Passover Seder with their grandparents, an event that he was looking forward to, and he took the news very harshly. And Shafi, in a professional manner, knew how to talk slowly to this woman, calm her down, and then give her exactly the tools she needed in order to help her deal with her child. Among other things, suggesting that she start talking about the 2 Seders they're going to have this year. One at home, now, just the family, and another one with the grandparents. Just like they planned, they'll have to plan it again and prepare for it and do it. And when she hung up the phone, the woman was a lot calmer, but she called up again 2 days later to follow up. And the woman was grateful twice. First of all, for the follow-up, which she didn't expect at all, which is very standard for Shafi to do. And second of all, for the professional manner and the very good tools that she got, which helped her make this period a little bit more bearable than it was beforehand. And this is just one example of the hundreds of interventions we had through the hotline and through our proactive outreach to families that we work with all the time. So that's one example, but I'd like to give you another one. Nothing about us without us is a motto used by people with disabilities around the world, and definitely one that Beit Issie is all for and promotes actively, especially when we look at our leadership center, our National Leadership Center with 17 groups. But I want to focus on just one out of these 17. It's a group, of course, all people with a wide spectrum of disabilities, whose main agenda is making healthcare more accessible to people with disabilities. You can imagine how they've been in the spotlight over the past couple of months. And during these months, they've made a lot of new connections, a lot of partnerships with other nonprofits, collecting all possible information about services for people with disabilities and putting them online so everybody could have them. But they also address personal issues. Like one adult, a man who has a disability and other underlying conditions and is reliant on prescription drugs, medication. And he called up saying he can't go out of his home. He has no way to reach the pharmacy and his medications are almost finished. He doesn't know what to do. So the initial response is quite simple. Somebody on the forum made sure that somebody went to the pharmacy, got the medication, the prescription drugs, and brought them to his house. But they also realized there was a much wider underlying issue here to be taken care of. And they approached, together with their advocacy team at Beit Issie, they approached officials in government, which we have a long-standing and very strong relationship with, explained the problem, and very soon regulations changed. And all prescription drugs from that moment were prescribed automatically for 3 months, and anybody with a disability could get home delivery service free of charge. Now, I understand that that's pretty standard in some places in the United States and elsewhere. We have to understand that in Israel, that is not a standard service. And that shows how strong our ties are with government, that we're able to make these changes so quickly, really within a day. And that's the way we worked on many other regulations and corrections we had to do, with the government actually approaching us many times and consulting with us. What should they do and how should they approach? The same goes with the healthcare associations in Israel. And another example, a third one, is from the underprivileged, what many times suffer the most and have the most basic needs. And I want to tell you about a family that is with us at the Kalansua Center, and for privacy reasons, obviously it's not one of the families you see in the picture right now, but their story is especially complex. They're a family of 5, wife, husband, and 3 children. The youngest child is a girl who has Down syndrome, and she has been at our early intervention center in Kalansua since she was 8 months old. Now, for various reasons, this family didn't have many opportunities to spend time with everybody together until the lockdown. And that was the first time that they were intensively together, and the level of stress started to rise immediately. Also, because of their financial situation, they had no laptop or tablet or smartphone in order for their children to remain online and in contact with us or with friends or with anybody else. Very early on, the mother indicated that domestic violence was also becoming a problem, and shortly after, the father left home, leaving the mother alone with 3 children and no support from her extended family. So that's where Beit Issie Shapiro's professional staff kicked in. First of all, the social workers at Kalansua, at our branch in Kalansua, started contact on a daily basis with the mother and the children to make sure that everything was okay at home and that she was managing with the 3 children. A day or 2 later, the family received a laptop from Beit Issie to their home. Already downloaded on it were applications and software specifically adapted for their child with Down syndrome. And from that point on, she could join our online nursery and online therapies that she couldn't receive elsewhere or otherwise. She also received special rehabilitation equipment on loan from Beit Issie Shapiro, which was crucial for her at this time of her development. And as a surprise, they also organized a box of toys as a present for the other 2 children. And lastly, they made sure the mother was in close contact with the social workers in her neighborhood so they could help her with her basic needs for food and clothing whenever she needed them. Like I said, the basic needs arise at these times of crisis. And now, when the Early Intervention Center in Kalantzwa is open again and the girl is coming back to us on a daily basis, she's receiving in-person treatments, but she'll also continue receiving the online therapies as a supplement to that, because that's already become an established product of Beit Issie Shapiro and something we're doing on a daily basis. And we've also realized, we knew it, but it was just enforced during this crisis, that we have to work a lot harder to provide assistive technologies to people who are in poverty, because that makes all the difference for many of them. We've already started a pilot program, and hopefully we'll be distributing tablets to the families next week. And we're looking now for funding to increase that as much as possible with additional technological support all these families need. So when you look at the online courses and the online inclusive university that we opened and all the online training that we didn't have before and we started now and many other online endeavors, and you realize how essential all this innovation is and how much greater of an impact we're going to have over the years to come. I mean, just over the last 2 months, we've had over 189,000 views of content that we've created specifically during the COVID-19 crisis. That's a staggering number that we're still grasping and trying to understand and seeing how we could leverage that further. These cases and these innovations and everything we've been doing over the past 2 months has highly motivated our staff, our professional staff, and our wonderful staff, and there aren't enough superlatives to describe the staff that I'm working with. And you know, we always work through the lens of our social responsibility, but we do this especially in times of crisis. It doesn't mean that we're not in some sort of a financial downfall. We are, but I'm not going to let the financials manage us. I'm going to manage the financials, and I'm doing that on a daily basis with the most professional staff possible. So if I want to try and summarize what we've been doing and how we've reacted to the Corona crisis, I can say that the main thing we did is stick to our strategy. And that is serving, innovating, sharing, and a lot of caring. And by serving, I mean working from day one, providing the best service possible to anybody who needs it, whether they're working with Beit Issie on a continuous basis, or they came to us now because they needed assistance. By innovating, I'll give you the example of the online therapies, whose results have been pretty impressive. I can tell you a story of one of the girls at our center in Ra'anana who was struggling through a in-person physiotherapy sessions from the start of the year because, you know, they're a little painful and difficult, as important as they are. And when the lockdown started, the therapist began working online with a child. But this time, the child was sitting on her mother's lap or doing the exercises together with her mother. And suddenly, a very special relationship occurred between the mother, the child, and the therapist, something we didn't really foresee. And now that the child is back at Beit Issie in Ra'anana, we can see how she's progressing quickly and how she's actually looking forward to the physio sessions, even though they haven't become any easier for her. And so we're starting to think, is there a certain blended model of online and offline therapies that we've been developing, which uses the advantages of each one to make a better whole? Of course, the Beit Issie Shapiro way is to start researching this, which we have, and the initial results we'll have soon, and we'll be able to publish them. And also by starting pilot programs. And we're starting now 2 pilot programs trying to work in the periphery of Israel to see how using these online services, we can reach a much larger population that hasn't had access to us and that we know have sometimes had to wait for over a year in order to get a physiotherapy session through other services. So we're serving, we're innovating, we're sharing in a lot of ways. And I'll just say a word about our international sharing, which is especially interesting. Every week during the past 2 months, we've done between 1 to 2 international seminars, webinars. If it's about when tech meets communication, or play and leisure for people with disabilities. and these have been very, very successful. Over 1,500 attendees in over 30 countries around the world, professionals worldwide. It's been so successful that now we're building a series of such webinars tailored to the needs of the Florida International University for their staff and students, one of our big strategic partners in the United States today. So serving, innovating, sharing, and a lot of caring for our staff. Those who stayed and worked on with us throughout this crisis, through very difficult times and lots of stress, working really around the clock, and also caring for those who had to leave us temporarily because of this crisis. We were caring for them through online therapy sessions open to all our staff members, through joint yoga lessons that we did together, and through sending care packages to those of our staff who had to be alone completely by themselves during the holidays. And we're also caring for them today, providing them the equipment they need in order to work in a safe and healthy environment. And you can see on the top left, the first hydrotherapy session in the pool late last week. So after 2 months of lockdown, Beit Issie is really awakening to life again. And it's amazing and so happy. It makes me so happy to walk in the corridors and to hear all the noise of the children and the adults working together and doing new things. And it's very enlightening to see this. I can't find the words to express exactly how I feel every day when I come back in and I see everything coming back to life. I can say that resilience is usually defined as the ability of an individual and organization to rebound after a crisis. And I'm so proud to say that at Beit Issie, we have not only rebounded, but we have used this time to learn, to adapt, to rethink, and to just get stronger and more motivated as we look towards the future. Now, this resilience isn't just out of nowhere. It's a result of 40 years of experience, a wonderful, wonderful professional staff that's a pleasure to work with every day, and a very, very special culture. And I think I mentioned Naomi's vision at the start, which helped us to persevere through this crisis. So this vision is still with us. It's very clear to us what we have to do. And as we're celebrating these 40 years, we're also looking ahead to what we want to celebrate in 5 years' time. And as we're speaking during these weeks, we're setting out new and audacious goals for the next 5 years, and we're building the strategy. And actually, I'm looking forward to the next town hall event, where I'll be able to lay out that strategy to you and ask for your partnership in achieving these goals. So now I'd like to thank you very much for listening to me. And as Esti said before, you're welcome to write down questions in the Q&A section, and I'll try to answer them to my best ability as we close this town hall. But right now, I'd like to introduce you to Ziv, whose daughter Ria you met at the beginning. Ziv, he's part of the family. And I'm so happy, Ziv, that you've agreed to share with us your experience as a father and as a family with a child with a disability and how this crisis has affected you. So Ziv, now it's time to mute me and unmute you.
So thank you very much, Amir. I appreciate very kind words of introduction. And as Esti mentioned, and Amir already mentioned, my name is Ziv, and I'm Ria's dad, which you've met earlier in this event. And as Ria mentioned herself, she's almost 11 years old and has been attending the special education school at Beit Issie since she was 6. I appreciate the opportunity to talk to you today and share our recent experience dealing with the coronavirus. I can divide the past 3 months into 2 periods, the lockdown period and more recently, the back to school period. Each period presented us, parents of kids with disabilities, with its own set of challenges. What is common to both periods are the feelings of uncertainty, anxiety, and stress. During the lockdown period, things were especially hard. due to the daily changes, misinformation, chaos, and instability. Our kids don't do well in such circumstances. They need stability, consistency, and a familiar routine. Ria in particular, she needs a stable routine. She needs to know in advance what is her schedule for the day. She has a hard time with unexpected changes, especially when it comes to activities she loves and looks forward to. For example, during the lockdown, on several occasions, one of her class staff would call her unexpectedly just to check in and say hi. That was emotionally overwhelming for her, and she would hide and refuse to talk. But when we scheduled those video calls in advance, and I prepared her for that, she participated nicely and was very happy. For us parents, there was an additional burden of taking on the roles of the occupational therapist, physiotherapist, and speech therapist, all while trying to create some form of normality for our kids. Throughout that entire time, practically from day one, as Amir mentioned, Beit Issie was there for us. They were an island of stability, support, and care. I simply cannot say enough how amazing was the staff at the Beit Issie school during this lockdown. We had daily video messages from the teachers, daily recommendations for schedule and assignments, remote learning and remote therapy, video calls to check in with the kids and with us, and Zoom video sessions with the entire class. This was a tremendous help for us. It lifted a huge burden off of our shoulders and helped us create a much needed routine for our kids. It also gave us and the kids the sense that we're still connected to the staff and to their classmates. For Ria, that was very important. For my wife and I, it was very reassuring to know that we are not alone in this, that there's someone we can depend on, that truly cares about our kids and about us. It really helped us get through that challenging period successfully. I can also tell you that this was not the experience of parents of kids with disabilities that attend other schools. Far from it. They were pretty much left on their own during that entire lockdown period. These days, we're in the back to school period. It presents a new set of challenges, daily changes, confusion, and concerns for our kids' health. In times like this, there's a need for leadership, compassionate leadership. Here again, Beit Issie shines. In particular, I would like to recognize Hagar, our school principal, who displays remarkable leadership in her communication, competence, and compassion. Hagar's leadership and Beit Issie's high standards of professionalism, safety, and care give us peace of mind. We know that this is the one place we can trust with our kids' health and well-being. In closing, as a father of a child with disabilities, knowing that my daughter is in the best possible place for her, where she is safe, receives the highest quality of care, with love and devotion, is a huge relief. It gives me that peace of mind that every parent desires. We are truly fortunate to be at Beit Issie. That's true always, and especially these days. Thank you.
Thank you, Ziv. Thank you so much. Thank you, Amir. Ziv, one thing before we continue, please tell Ria I can relate to her. I also need my schedule every morning, so we're good with that.
I will, definitely. Thank you, Esti.
Good, good. So I want to tell you all, at the conclusion of this, we're going to take some questions now, but as a final, I was told to do a soft pitch. So I will softly tell you all that we could not do this without you. We do not take you for granted. Please understand this, every one of you. 140 people signed up for this and counting. We do not take you for granted, but We could not possibly continue to do all of these services. Amir is saying next week we're sending out God knows how many iPads and laptops. Emergency crisis counseling, immediately calling a student in crisis. A child who, God forbid, is playing with matches in the middle of the night. Yes, we've had that. This has to be done with funding, and it takes a lot of funding. So we're asking you right now to help us in 3 ways. Number one, you need to understand our children have been home for 3 months. Yeah, they're having a tough time. You know, they're bored. They're catching up with their schools. They might have missed a couple months. So imagine, as Ziv just told us, a child with disabilities needing to catch up 3 months worth. You know what? It doesn't take 3 months. It's going to take them 6 to 8 months. So we are going to quadruple our efforts. Amir is going to have everybody working quadruple time. I guarantee you that. And you know what? After working with these educators and therapists, they want to do it. They do it with a full heart. What we ask of you now is that you quadruple your efforts as well. Tell your friends and tell your colleagues about us. That's probably one of the biggest values that we can get, is if you spread the word. Tell everybody you can about Beit Issie Shapiro, about what Ziv just described as the uniqueness of being there for a child with disabilities when everybody else thinks they might be abandoned. Share the information that you're getting. We send out e-blasts. We realize that. We send out a lot of updates on Facebook. Please share that with everybody and anybody you can. Get the word out. And the third part, just call me. Call me. You have a representative in Florida, you have Denise. You have a representative in California, you have Soraya. You have Naomi. Naomi, I'm volunteering you. She's always available. Call us. Call Amir. Call Ronit. Call us. Ask any questions you want. Say, I want to help you. Obviously, it's the finances. We need to continue these amazing programs, because what we've done in this crisis, but thank God, turning lemonade from orchards, we could only do because of all of you. We thank you for staying with us at this time. We thank you for coming through, especially at this time. A lot of you doubling donations, saying, of course, Esty, of course, we'll do whatever we can. We thank you. We bless you. We wish you health, 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 and many, God willing, many, many more years of working together. So I have a couple of questions here. I'm going to direct them to whoever appropriate. One of the questions here is, somebody's asking, how are the schools currently operating? Are there any limitations and adjustments that have to be made due to the situation? The answer is, I think we answered a little bit of it before, but I'll let Amir, you can answer that. How are the schools operating and what are the differences, I guess?
All our daycare centers are back to normal operation, with almost all the children back. In schools in general right now, it's not mandatory to go to school. But I think it's a vote of confidence from the parents when you see that all the children are there and they're trusting us to take care of the children and to take care of the children of their health. So the schools are operating basically on a normal level. They're getting most of the therapies that we gave them before, and not everything yet. We're trying to bring everything back online as fast as possible and as efficiently as possible. And of course, we're doing everything with masks and social distancing as much as possible, according to government regulations.
Thank you, Amir. The next question was, the hotline just for parents and families of children with disabilities, or was it also for adults with disabilities? Amir,
The hotline was for parents, for families, for adults, for children, for English speakers, Arabic speakers, Hebrew speakers, whoever. We put a lot of effort into having as many people as possible aware of the existence of the hotline. We advertised everywhere possible. So it was open for everybody.
oh, this is a good question here. For Ziv, if that's okay, yeah?
Sure.
I guess a panelist wants to, a parent wants to know if there's anything you've learned about Ria's abilities, we will stress that, as a result of this period, or about being a father to a child with disabilities. Anything special you've learned?
Well, yeah, this will probably take me an hour to cover everything. I've learned from her and from being her father. In fact, I wrote a whole blog on it. If anyone's interested, they're welcome to read it. But obviously, this was a new situation for all of us, and we didn't know how Ria would respond to it. But I must say, she really surprised us, and maybe we shouldn't have been surprised. She was very quickly to adapt. She kept a very high spirit and was always in kind of good form and happy. And with the exception of those occasions where things happened unexpectedly, as I described, especially with people calling in when she was not expected, or when things were being canceled unexpectedly, that's when she had a little bit of difficulty, but she was very quick to recover and get back to herself. And I think overall she showed, as Amir mentioned, not just resilience, but great fortitude and great attitude, which really helped us get through this, because when she was in such a good mood and so happy, it was much easier for us to deal with the situation and go along with our daily lives. So she was absolutely incredible, and she's always a role model to me.
And somehow not surprising. Thank you, Ziv. Somebody asked a question. I can't really answer it live, but I'll try. Somebody asked this wonderfully brilliant question, which was, how much, Amir, you're going to love this, how much will it cost for the new computer system, laptops, iPads, innovations? I don't think I can give that answer live right here, but I love it. If I say $1 million, will that be a good answer? But I will tell you, whoever that was, thank you for asking that question. If you could direct that to Ronit and Amir, I'm sure they'll give a real concrete answer to that. So thank you for that question, though, whoever that was. Naomi, this is a question for you. And it's a beautiful question. Did you envision Beit Issie Shapiro turning into the global influence it is today?
Wow. A lot of people have asked me that question, and I often used to say before the Israel Prize that if I'd known what I was getting into, I'm not sure that I would have gone that way. Except now, I am so thrilled. I think that I envisaged a different Israel. I envisaged that I believe in people. I believe in the ability of people to accept other people, and I believe in their ability, once they know and once they have knowledge, to take that step. And I cannot say that I envisaged that we would ever get this way. I never envisaged the Israel Prize. Now that I look back and say, Beit Issie deserves this award, because this is the work that has been done, and every moment. And Amir, if I'm around for you, it's because I love being around and seeing the things that excite you. The day that I came to Beit Issie the other day, I popped in just for a few minutes and I saw the parking ground full, my eyes filled with tears. I was so thrilled, because I had watched and I'd been with you, seeing what was happening and seeing what was, you know, the plight of the families and of the children throughout the country. So the answer is, I don't know what the answer is. I never envisaged, but I did envisage a wonderful Israel. And I'm so proud that we have a better Israel, and we still have so much more to do.
Thank you, Naomi. Somebody's asking very interesting question. They're actually just asking if there's a higher level of stress among the staff for different reasons. Has Beit Issie experienced similar, and what were your solutions? I guess, Amir, that would be you.
I can say that the shift to working remotely was instantaneous. And I think at the first stage, people didn't really have the time to think about it too much. It just happened. And the stress came at some sort of delay. The main thing we did is talk a lot. and have a very clear message for everybody, because they were hearing a lot of conflicting regulations and news and things from the media every day, every hour, sometimes. So we would sit together as management and give a very clear message all the time. I also mentioned that we had therapy sessions open to any staff member who wanted. And what we just discussed today is that actually after a few days, everything kind of went into a new normal, and there was a lot less stress, and just people just fell into a new routine. But now, as we're going back to the old normal, then we're feeling the stress levels rise again. There's all these changes, and can we come? Should we not come? Is it safe? Is it not safe? The children at school and everything's happening around us. So again, we're having to deal with high levels of stress, and just keeping an open ear, an open heart to all the staff and also to parents who are working with us. That's the main secret behind this.
Another question that one of our guests have asked is, which services have resumed operating? I guess Amir answered half of that prior to. We can answer that in more detail. If they're currently operating services for children in the schools, and how has the situation affected the other programs? I guess we're talking about the hydrotherapy, the snoozlin, programs like that.
Well, in effect, as of the end of last week, right before the Shavuot holiday, more or less everything, we're able to resume everything, but it's taking time to put things in motion, taking time for clients to come back for their hydrotherapy sessions. Not everybody wants to come back immediately. A lot of them are afraid. We have to call them up and offer this and talk to them. So everything is possible, and now we're putting a lot of effort into making it actually happen, discussing with it. I think what's one of the things that's pleasantly surprising is that the staff want everything to come back, want everybody to come back. The staff aren't afraid. They want to start working. They understand the regulations. They understand how they have to manage the different children and the adults and everybody who comes in. And they're doing that in a very brave and a very great effort on everybody's behalf.
Great, thank you. This is a very, I think, a very emotionally charged question that somebody asks, how that many children and adults are facing obviously a variety of physical challenges, and a lot of them can be sensory. And the masks, I know for myself, just putting the mask on it creates agitation. So how much more so for a child with challenges and an adult with challenges? And masks and gloves, the question that this person is asking is, masks and gloves compose a great deal of discomfort, behavioral outbursts. How are these factors being considered for individuals and students' needs and the various health and safety precautions that come along with it? Amir.
I can say that the initial regulations for reopening the school were to maintain under all conditions social distancing of 2 meters and masks and gloves at all times. And then our staff said, that's impossible. We can't work with children with disabilities in this manner. And we started hearing that from other schools that we work with and that we're in contact with. So again, we used our connections to government, to the officials there. We actually changed the phrasing of the regulations to read as much as possible. They added those few words in, and that made all the difference. So our teachers are professional enough to understand when they have to use masks and gloves and social distancing, and they abide by all the regulations as much as possible. But when they see that the situation doesn't, they can't deal with the situation in that manner, then they'll do it in the best manner possible, taking care of themselves and the children as much as possible, but using their common sense on what's the best thing to do and their professional outlook on the situation. And I feel completely confident in the staff that they know how to use their judgment in these issues, and they're using it wisely and professionally.
The last question kind of pertained to that, and that was if a child or adult has a hearing challenge and cannot read lips, what about wearing the mask? And I think that's where Amir just presented it, as that our educators are amazing, and they will use their judgment correct, Amir?
No, it's 100%.
Okay. Another question, somebody's saying about the webinars have been very well received internationally. They want us to tell more about the plans to provide training consultation outside of Israel. That's interesting. I actually attended the webinar given by the lead psychologist, the director of the center. And what she mentioned something to me that really was mind-boggling, which is, you know, there's a real HIPAA law, and that is, you know, giving the therapy via Zoom or the phone, which had to be, we had to kind of, you know, bear around that. And the therapist, I said to the therapist, after all this, you know, is there a silver lining? She found that a lot of our patients actually responded much better in a more positive manner to the Zoom. And so the answer is yes, that the webinars that have been well received will be, from what I understand, Amir, will be continued and actually more brought on, you know, for more of us to learn from.
I can say that with the webinars, we have people, staff of all ages at Beit Issie Shapiro. Not everybody was fully aware of the power of these webinars. And I think today the staff has gained a lot of confidence in this tool and believe in it. And we're starting to create more and more. I've just spoke to the manager of the Leadership Center today, who's all the time been thinking, you know, they're planning how they go from one conference to the other to spread the word about what we're doing and present the model. And now she just told me, you know, we don't need to do that. We're just starting to create these webinars about leadership and the model we've created of how to build a leadership center and leadership groups. It's going to happen more and more. You know, so we don't have a schedule yet, but we will have a schedule and we'll be online. And of course, all these webinars are recorded so people can access them afterwards and continue using that information. And we're all very excited about these new possibilities that have opened up to us.
Great, excellent. So that is exactly what we were talking about. It brings us back to the beginning of the silver linings, that we will not have felt like we went backwards in this period of 3 months. We've actually refused to say that. We are saying that we're going to look at it in a positive way. We're looking at almost like a new beginning, a new sunrise, a new dawn. And our goal from all of this, our hearts, we have to say this, Amir and the team, we always say this, our hearts continue to go out for all that became ill, all that was suffered, and anyone who lost anybody. And we have to say that here in front of everybody now. And for our children's sake, look, for my children, for your children, for our grandchildren, we have to build, we have to think of positive, and we have to learn from this. And what we've learned is that we are strong. We learned from Ria that we're strong. And we wake up with a smile and we get up and we say, okay, you know, what can you teach us today? My job is to say, unfortunately, it doesn't fall from the trees and we can't create all of this based just on lemons. We need to raise a lot of money in the next few months. We need to raise probably upwards of $2 million. And that's where I'm going to ask all of you, all 140 participants, to do your best and give till it feels amazing, and ask your friends to give and introduce them and share us on Facebook, share this live webinar on Facebook. And we're going to need to do it in the next at least 8 to 12 months so that we can continue to not just share. It's not just sharing. That's what's incredibly unique about Beit Issie. It's not just Israel. It's not just Ra'anana and Kalansua and wherever we are. It is a global effort. What we learn here is going to be globally shared, taught, educated. We're in universities in America. We're in JCCs in America. We're in places that the world doesn't know about, but we're going to tell you. And we're going to ask you to share it as well. And we thank you from the bottom of our hearts for being there for us, for taking all of our emails. I know I bug a lot of you, and for taking our phone calls, for taking whatever we throw at you and saying, and never ever saying no. So thank you so much for participating today. We look forward to having you again for the next one, and have a great Sunday, Yom Rishon, Shavua Tov, and we should all have only health, peace, and happiness with all of us. Thank you. Bye.
Thank you very much. Goodbye. Good evening, good afternoon, good morning to everybody.